whenever we have somebody that's dealing with neck pain, shoulder pain, particularly pain with the overhead position in the top of the shoulder area, there's three main areas that we want to work on to create some more tissue mobility and resolve some of those pain symptoms. So the first area we want to work on is that upper trap. So the upper trap is coming from the neck to the top of the shoulder, and when that becomes hyperactive, trying to stabilize that shoulder, that becomes painful. So these are people that are going to have pain, either neck pain or top of the shoulder pain, and kind of spreading side to side. They will often find relief with doing a side bend stretch, but that's only a temporary resolution of their symptoms. What we want to do is to use a lacrosse ball, is we're going to lay down, and we're going to put the lacrosse ball just on that upper trap, right where that painful spot is, roll around till we find our tension area, and then from there we can just breathe, or what we want to do is start to create mobility. So keeping that pressure and then mobilizing the arm, and it could be up and down like that. It might be out to the side, right? It might even be a reach up to the ceiling, back and forth, right? But we want to soften up some of that tissue. The next area we want to work on is the pec minor area. So as that shoulder blade gets pulled up from that upper trap, it also tips forward. So what we want to do is get to the front of that chest. So what we're going to do for that is we're going to take the lacrosse ball and we're going to place it on the ground and we're going to lay our chest right on top of it. So I'm going to put my hand behind my back. I'm going to lay right on top of that ball. And from here I can oscillate up and down or side to side to find my position where I feel tension. And then I can either just breathe and hold that position, or I can try to lift my hand off of my back. And that's going to mobilize it to the front of that pec. Now for both of those techniques, for the upper trap and the pec, if the ground is too intense, too involved, you can do both of them standing against the wall, just leaning your shoulder against it, or leaning your chest against the wall. Less body weight, so not as tense. The last part, and this is a hard part to get to, is part of your rotator cuff muscle. So on the inside edge of your shoulder blade, so between your shoulder blade and your rib cage, there's a muscle that often gets neglected, and that's an internal rotation muscle. So what we want to do is we're going to get the ball right into the front edge of that shoulder blade. So we want to put that ball right inside the armpit, just inside the shoulder blade, because when we go more towards the edge of the outside of the shoulder blade, that's going to be more lap, but we want to get more inside the shoulder blade. And from here, we're just going to lay down right on top of it, and we might need to roll around, find a nice tender spot for ourselves, and then when we get there, our mobilization can be that we're just adding rotation of that arm back and forth. So between those three techniques, to handle the upper trap, the pec minor, and that muscle of the rotator cuff is your subscapularis, that will give a lot of people relief when they get to that overhead position, also increase mobility, increase efficiency, leading to better lifts.